Dr. Sandy Martin from All Star Family Chiropractic, and you are here with Meet the Doulas. And so here I'm going to let you introduce yourself.
Hello, I'm Kim Ferguson of Blissful Birth Services, and I have been a doula for about 15 years in this community, and I'm super excited to be here tonight.
And who are you?
I am Abigail Thaler. I am a newly certified doula working with Kim in St. Joe area. So I am extremely excited to get to express what we are going to talk about today.
And that's exactly why I brought them in too, because I have a lot of pregnant mamas and families that want to embrace more, right? We don't realize what's out there, especially when it comes to resources or support that is actually available to us. And one of the biggest questions I get when I say, hey, have you thought about who your doula is going to be? And they're like, why would I need a doula? So why don't we start with there? What is a doula's role and why would people choose a doula?
Awesome. You want to take that or you want me?
So a doula's role, I'll start there, is essentially someone who is going to support you and empower you through your pregnancy, even fertility, pregnancy, labor, postpartum. The doula role, there's a lot of different ways you can take the doula. We are birth and postpartum doulas, so we focus on pregnancy and postpartum. We advocate. What's another thing that we do? Obviously physical help during labor, but I feel strongly that we really focus on emotional support.
And education.
And education.
Absolutely.
Evidence-based
birth.
Yes.
Education.
Yep.
Okay, these are two amazing topics. Like these are emotion and education are two big trigger words
Definitely.
right now because it's all about how we feel and feelings are now being heard.
Yeah.
Right?
Yes. Yeah.
So tell me more about the emotional aspect that is now coming to light inside a hospital room.
Okay.
So when you are giving birth, you are at your most vulnerable and you have a lot of different things that you are feeling in your body. Birth is a mental, physical, and spiritual journey. And so as doulas, we can come in and kind of right from the get-go. Sometimes people, I know I have people sometimes that the minute they get pregnant, they reach out and they talk to me about all of these different things. And so we really can kind of just come in and help with that. And I just forgot what the question was, so forgive me.
What's the emotional component?
The emotional component,
in
yes.
the hospital room.
In the hospital room? Oh, well, that is a loaded question. It really depends on each individual because some people, it depends on how they feel when they go to a hospital. Some people equate going to a hospital for sick people.
Yeah.
Birth, in our opinion, and this is just our opinion, you are not sick. Birth is something natural, something that you and your body are working together.
Fun fact, that's good doctor school. Pregnancy is listed under disease and condition. Right?
No.
And, I
I
completely, yes.
Yeah. We steered off that.
So that is then where even that emotional piece, it starts way before that, but depending on what your history has been in and out of the hospital, what surrounds that, there are people that we have come up alongside that have quite an extensive medical history where the hospital always equated sickness and or death. In other people that they've never stepped foot in the hospital. So now they're going into a hospital and they're surrounded by, fear, what to expect. Well, I've heard I have to do this or I don't have to do that. And so one of the biggest things we want to help people is to understand what their options are. Because I believe that if we don't know what our options are, we have none. We fear what we don't understand.
Yep.
And that's what we're here to help change that. Because when it comes to labor and delivery, whether you're in the hospital, you're having a planned C-section, you're at home, you deliver your baby on the side of the road because it happened that quickly, there are options. And each person is going to have a very different experience. Dr. Sandy, you've had 2 babies, correct?
At home.
And tell me, were each one of those pregnancies exactly the same?
No.
Were each one of those deliveries exactly the same?
Not at all.
And it is the same out there for every other family having a baby. And that's actually one reason why I love my job, is because it's never the same. And we love it, we're passionate, and
Forever learning.
Always.
Well, that's everyone has to learn. Right?
Definitely.
So a lot of
Always.
people out there. So I love that you guys focus on education too, because education dissolves fear. Just like you were talking about that too. So the more we know, the more we can grow, and because we're growing humans too. And a lot of people out there are like, well, this is the way my mom did it, or this is the way I was born, and they didn't do this, and we didn't need that. My body was made to deliver babies, so why do I need help?
Right.
There's a lot of other things out there that can come up when we're talking about, like, oh, I think I know.
Sure.
So tell me about some of the options that you guys have prepped already for this conversation that you want moms to know about.
All right. You want to start, Abby?
I'll start with the first quote unquote myth that where you can't eat and drink during labor. That is a myth. Us as doulas, we definitely encourage you to eat and drink during labor. Kim and I were discussing that labor is much like a marathon. I think I've heard many parents refer to their labor as a marathon. There was a lot of points where you feel like it's very intense, and then it kind of settles and gives your body that natural rest moment, and then you're back on again to finish that race. And you need nutrition, and if anything else, hydration, water throughout the entire thing.
So someone else brought up in talking about this too. I'm like, but if you have an epidural, are they going to allow you to eat and drink?
Sure. I love that you say allow, because I want everyone to be reminded that it is your choice no matter what you are hearing. Don't let anyone fear you into making a decision. Kim brought up, we were asking this question, we were talking about it. Well, what are the risks if I were to eat a hamburger while I'm in labor? What would the risk be if I were to get an epidural? And will you just share what the example that you gave us? Because I thought it was funny.
So a lot of the times when people get an epidural, one of the reasons why they talk to you about just having like ice chips or water is a risk that an impending C-section, if you have food in your belly, you can aspirate on that if you're put under, either put to sleep or different forms of anesthesia. And so one of the things I combat that with is any person out on the street could have an urgent situation where they required surgery. And so you just need to understand the risks. If I was to have an acute appendicitis and I just ate dinner, but my appendix had to come out, they are going to be mindful of that, understand that, but I'm going to also have to know my risk that I may aspirate, there may be complications. Now, when it comes to birth, the fallacy that you can't eat or drink, there is some truth to that in terms of epidural. I'm not going to feed you a 5-course meal if you have an epidural. I will give you some water, some ice, some sips of juice. We're just going to slow that down a little bit. When you are in labor, we know that the uterus at the time of delivery is one of the largest muscles in the female body. And our muscles need sustenance. And so that is kind of our stance. And you said water, even more important, a blend of electrolytes. So there are a lot of things on the market these days that you can add to your water. Coconut water is great. Natural electrolytes like using honey, lemon, some good sea salt.
Oh, we love the honey sticks.
Honey sticks, electrolyte waters. You have liquid IVs out there, LMNT. There are a lot of different things that we recommend that will help you in labor.
Other than just ice chips.
Absolutely. So if you find yourself in that situation, it's really important for you to ask questions.
Definitely.
And that's going to lead me into another thing that I want to talk about with you today, which is about making sure that families are able to make informed decisions. And how do we go about doing that? Because there are a lot of things when it comes to labor, delivery, birth, and postpartum that people will come to us and say, well, I heard you can't this, or I heard you can't that. And that fires us both up, our entire team, because it's not about can'ts or cans. It's about what works best for each individual scenario.
So I love that you're bringing up that it's each individual scenario, because I'm going to dig deeper, because when we choose to labor like in a place like a hospital or a place that has a system and protocols. And like you said, we have choices even in those system and protocols.
Absolutely.
I mean, is there, as a doctor myself, if someone doesn't follow my protocols, I am allowed to dismiss them from care. Is there that risk of happening during labor?
I think so.
There is that risk, but there is also something called informed refusal. And a lot of people don't understand that in hospital settings, home birth settings, birthing center settings, you have informed decision making for informed consent and informed refusal. So you absolutely have the risk of potentially being dismissed from care. However, you also have the right to sign a piece of paper and saying what you prefer and what you don't, what you're open to or you do or do not want. There are a lot of decisions that people make throughout pregnancy and the labor and delivery journey, and it's not one size fits all. Absolutely. And so you absolutely have the right to refuse anything. The biggest thing is making that informed consent decision. And I teach a lot of childbirth classes in this community, and one of the biggest things I try to impart into the families I serve is using our brains. And that means benefits, risks, alternatives, intuition. What does your gut say about this? And is this something that needs to happen now?
Did you guys catch that? BRAIN stood for BRAIN. What were
Yes. Benefits, risks, alternative, intuition, and does this need to happen now or can I do nothing? And when you are presented a situation and given these options, you are able then to make a very good informed choice for you and your situation, or an informed refusal and say, you know what, no thank you. When you are doing that, the biggest thing I want to say is you are standing up and saying, you know what, I understand what my options are, I understand the benefits and the risks, and I am willing to say I made this choice. It's an informed choice. And so there are every scenario in pregnancy and in labor that you are able to make these choices. And in most cases there are alternatives. In some cases there are not. But when you are able to make these choices, I feel like you are able to make a good choice, and thus then in most cases parents and families that are making these choices don't question their choices.
They make feel good about it.
They felt like they were in charge.
I want to add that a lot of times when we're making informed decisions, when our parents are, there's no room for trauma.
Right.
Because they've thought it out. They knew what the consequence was before making that decision.
So talking about planning it out, how many of your families you work with do you encourage to have a birth plan?
Oh, I feel like that's a requirement.
It is, but let's back it up a minute. I like to call it a birth preferences.
Got it.
Because a plan means, here's my plan, it's not gonna go this way, it's not gonna go this way. We just talked about labor being a natural thing. And we know when you go down that, it can go this way, it can go this way, it can veer back. And the biggest thing is having a preference in a perfect world, a perfect situation. These are the things I want. In understanding if we have to stray from this, then you know what your options and your alternatives are. And we work very hard to make sure that in every situation, in every hospital setting, because every hospital is a little bit different, policies and procedures, and being someone that's been doing this for a while, I have finally started learning to educate families, not just about what they want, but also making sure they communicate with their provider and making sure the provider and the hospital policies line up. Because a provider may say, oh, yeah, you don't want that IV, you don't have to get it, you don't want to pour it, we don't have to do it. But when you get to the hospital, you are presented with something different because this is the hospital's policies and what they do. So I want people to understand, to make sure that they ask those questions, because I have been in situations, provider says, yeah, I'll do that. And they may be able to, or have experience with that and work in several different settings. And so that has been something too, that when you are making a choice for birth, like having a doula or having a natural birth or even having a planned C-section, your choices and decisions, you want them to line up with your provider and the facility in which you're doing that.
Have you ever heard the story of people experiencing where they made this birth plan, they presented it to the provider, and no one reads it? Like it comes time to the case, and like you're here delivering, and no one knew your birth preferences, even though you prepped them ahead of time.
Sure.
Absolutely, yes. And that has happened. I have been doing this for a while, and I can tell you when I first started and families would come in, I've seen the eye rolls, and I've heard people say, oh, they have a plan, this is gonna be a C-section. That is not the case anymore. At least when I'm working with families, or anyone on our team is working with families, we know that we are educating them in making sure that they know what all their options are and that they understand what these preferences are. And then I also make sure that they are prepared and they take them with their to their doctor's appointments and bring them with them to the hospital. And the way that we present those and the way that you even write them out is very different than it used to be. We call them preferences, not plans. You put what you'd like down there, understanding and recognizing that if we have to stray from this, we just want things explained to us.
Yeah.
I find in most of my experiences, families want to be treated as individuals, not on that conveyor belt.
Yeah.
They want to know what all their options are and be spoken to like educated individuals in those situations. There are some families that don't care and they're fine with, okay, you do A plus B plus C plus D, I'm okay with that. And that's completely fine too. That is another thing I want to clear up, if that's okay with you.
Go for it.
It's easy how it starts flowing.
I know.
A lot of times people think that doulas are only for all natural births or only for people that want this or that.
Wait, so you're telling me you do it for like C-section, people who want a C-section?
Yeah.
Okay.
Yeah. I will be a doula for somebody who wants an epidural and they plan on having that. I will do that for somebody that says, I don't want any interventions. We are not just one or the other.
Right.
Doulas are there. If you choose to get an epidural, we're there to help you until you get that epidural and guide you in that. You get that epidural, we're there to kind of fill in the blanks and hold space for you in your hospital room. Just because you get the epidural doesn't mean it changes. You're still having a baby and we're still gonna support you through that process and just kind of guide you in there. I feel like we nowadays are kind of that glue that helps even with the flow between the hospital and the family members and all of that. We just really come up alongside of everyone. We are all part of the same team. We are working on the same goals. We just help the families to be able to have their voice in that. And if something does go one way or another, we can kind of help step in and reassure also.
Awesome. Yeah. Let's go back to this list. What's number 2 for these hidden choices for expectant parents?
Vaginal checks are optional. You do not have to have cervical checks at any point throughout your labor if you don't want to.
Why would we choose? Like, what are the benefits or what are they looking for when they are checking for my vagina?
Yeah. So they're checking your cervix. They're looking to see a couple different things. So when the cervix is ripened, you are going to have, it's going to be soft, kind of like, it would be the tip of your nose, correct? Yep. So if you touch the tip of your nose, that's what they're looking for, just the kind of spongy like feel. And then obviously the dilation. And at that point, is that going to give you a time on how long your labor is going to last? No, it's not. So vaginal checks could be reassuring for the parent who is like, am I even dilating?
Am I even in labor?
There are times that denial gets the best of us. We start second guessing ourselves, going against intuition. We're like, my body wasn't made for this, all sorts of things. Typically when that's happening, we know that it's close.
Yes.
But so sometimes, again, those could bring reassurance, but they're not necessary. And we do run the risk of introducing bacteria into the vagina if you are going to continue to get cervical checks. So that's typically hospital policy. They'll try to limit, especially if the waters have been broken, they will try to limit the amount of times that they provide cervical checks. But again, it's your choice, because I know it's very uncomfortable for most to get those cervical checks. So if that's not something you're comfortable with, don't do it. You have the option to say no thank you.
Awesome. Number 3, voice your choices.
Voice your choices. It goes back to being in charge of your choices and knowing that you have the right to decline anything. You do not, going back to vaginal exams, we know that it gives us information. It does not tell us when you're going to have a baby. It doesn't even guarantee that labor is going to start today or tomorrow. You could get a cervical check and then an hour later have a baby. You could be 0 and nothing. And so voicing your choices and having a say in that is extremely important all the way through, because I prep families when we're doing classes and talking about this. When you have this baby, if a pediatrician comes in, and this is going to sound very drastic, and he looks at the baby and he's like, I'm not really sure I like that finger, the way it bends. I think we're going to remove it. We're going to remove it, okay?
I just got fear. I don't even have a baby with a finger right now.
But do you know what I'm saying? You're going to ask questions.
Definitely.
You're going to want to get information. why wouldn't we do that when we're pregnant and asking questions about
Yes.
labor, all of those things?
Okay. So, voicing choices, I want to actually dive deeper about some of the things that are required in a system. And I mean, I went through a midwife and birthed at home too, and I had all these options, and we discussed them about the pros and the cons of all of them. So, one of the things I like to discuss, and like you guys are talking about, is refusal. It could
Informed refusal.
Informed refusal. What about the glucose tolerance test? What are your thoughts? What are the pros and cons on doing this test?
Wow, that's a big one. Pros and cons. Well, there are a lot of ways to do this test.
Yeah.
So the pros help us to know, because we know that insulin resistance and gestational diabetes, for some people, when you are gestational diabetic, we know that somewhere along the line you are potentially a diabetic precursor, something like that. I'm losing my words here. And so it isn't a test that is done in pregnancy. You absolutely have the right to refuse it. However, you also have the right to do that test and then make decisions based on that.
Yeah.
There's more than one way to do that test. In typical hospital medical providers' offices, they offer a drink, a glucose drink that kind of tastes like, in my opinion, gross flat soda. It's disgusting. Or there are options. You can ask for options. I had my children 29, 17, and almost 15 years ago. And my 17 and 15-year-old, I asked for something different because, well, a little TMI about me, I have a gag reflux. And so I drink that stuff and it's like comes right back up. Ooh. I used jelly beans for one of the tests. And then for the my last child, I asked if I could just poke my finger after my meals, and if I had high numbers, we did it but it was fine. I kept a diary of food. There are other options, and people have the right to ask for different options in that if they don't want to do it that way. And then you also have the right to say no thank you, understanding that if you are gestational diabetic, there can be some serious consequences if it's not managed properly in terms of your diet. But you also don't have to automatically go to medicine. Right. There is a fantastic book out there by Lily Nichols, Real Food for Pregnancy and Real Food for Gestational Diabetes. And that is one of the books I highly recommend all my patients, whether they're diabetic or not, gestational or diabetic in normal non-pregnant life. And that helps them to pick good foods and choices that will help them regardless. Beautiful. And help them keep their numbers in an appropriate space. We know for pregnant families, pregnant moms in particular, that everything they eat and drink is one of the biggest things they can do to help have a healthy outcome for mommy and baby. The risks when you're gestational diabetic is a larger baby. We know that. And so by kind of declining that test, if you chose to do that, you just want to make healthy choices throughout your pregnancy. If that makes sense.
It makes a lot of sense.
Very aware.
I mean, even if you did do the test, you still want to make healthy choices.
You still want to make healthy choices.
Yeah.
And I always say, even if that's not your norm, you know, we can do this for 9 months. You know, you can do anything for this period of time if you had a big picture, a window into the future and could see what it would look like, I bet you if you made A, B, C, D decision and saw this result or saw it different, you'd probably change those choices. I don't want families to ever have to be in that. And so even, like I said, in your normal everyday life, you want to do whatever, eating, drinking, all of that. But in pregnancy, we do know that that is the biggest thing you can do.
Yeah.
So what are your thoughts about women that choose to drink caffeine or wine during pregnancy?
It is all in moderation.
Yeah.
We know that you can have a certain amount of caffeine.
Yeah.
I believe it's 300 milligrams or less,
So
somewhere in
that's
there.
like 2 cups of coffee.
It is.
Per day?
You
Wow,
can.
yeah.
But the bottom line is too, balancing that.
Yeah.
We know a 3-ounce glass of wine. If you go to other countries like Europe, they traditionally have small amounts of wine with every meal. We know that there's actually a pro to that, depending on what it is, but there can also be the con. You've heard a lot about, and people have read a lot about fetal alcohol syndrome. So you have to there's balance with everything, just like everything else in life.
Exactly.
Yeah.
What about strep B test?
Strep B test.
We were just talking about this.
Didn't we just talk about that today? So what would you like to know about it?
I don't know. I mean, would you push people towards it? Where the
Just
I mean,
getting
there's not too many
tested for
risks.
it?
Right.
Right.
Yeah.
It's a choice. That's why I'm gonna point it
Definitely a
out,
choice.
right?
It's a choice. Here's the thing. You can choose to be tested for it and do nothing.
Yeah.
You know your status. You can choose to be tested for it and have an educated conversation with your provider about what your options are. If, for instance, you're group beta strep positive, but your waters are still intact, meaning that your waters haven't broken or been released. I use a lot of gentler terms because I teach hypnobirthing. But when your waters are still intact, we know that your baby is in this protective, sterile encasing. And thus, your risk increases once your waters release and baby, if your body is GBS positive. We also know about group beta strep that there are periods of time when you could test negative and test positive for it. So you need to make educated choices. There are other things you can do to help increase your microbiome and your gut health, your vaginal health, all of that. And so even with GBS, it's not one size fits all.
Yeah.
What's the risk to the baby if someone tests positive for strep B?
The risk to the baby is contracting group beta strep, which is a sickness that if you did your research and read about, it is something that baby can be fine one minute and be very sick the next and have that infection. If you are group beta strep positive, the recommendation is prophylactic antibiotics in labor. They would like, especially if your water breaks, to have you come in and get a dose via IV. Which usually the medication of choice is a penicillin of sorts, like an ampicillin. They like for you to get that in, and the truth is they would like for it to be in within 4 hours of delivery. And that they feel like having that in you 4 hours is enough to pass to baby to be a prophylactic protectant over baby. But we also know a lot about how antibiotics can kill our gut and microbiome. So there's a lot of controversy out there. So there are some probiotics and things that you can do to help protect and ensure a healthy lifestyle for you and baby. And that is also another thing that's not one size fits all. There is a small percentage of babies that can become infected with GBS. But there's a great evidence-based birth article and other articles out there that if people want some information, just let us know and we can get it in their hands. Because again, it's a personal preference also.
Definitely.
So
Definitely.
another one, episiotomy versus tearing.
Yes, that's a good one.
We get that question a lot.
They do.
Because I think, and maybe this is just me assuming, but I think that is one of the major fears
It is
in
a big
birth.
fear.
Is, you're birthing a baby. There's already recovery that comes in with postpartum. You have a plate-sized wound where the placenta detaches. We have 6 weeks just to even give our body rest for that. You tear, that's a whole nother worry on, healing.
Episiotomies.
My hand-down advice would be natural tear. Natural tear, hands down.
But why do you say that?
Better recovery. Recovery.
So I was even taught as a doctor too, and if you think about this, an episiotomy is going to be a straight knife cut. Well, if you rip a piece of paper, cut a piece of paper, what are the odds of putting that piece of paper, two straight edges back together?
Right.
Versus if you were to zigzag piece of paper back together, more like a puzzle, this is going to heal better than this is going to heal. Yeah.
I want to, though, just turn it around for a minute
Yep.
because I've been in this
There's
situation
choices.
before.
Yeah.
And on occasion, the provider, and this is where that trust in your provider comes in.
Yeah.
I can say in my career as a doula and doing this, and I have worked with a lot of families, I have only seen an episiotomy less than 5 times.
Okay.
And in those instances, the provider that I was working alongside, I trusted in very much so. And at one point, a provider did make a recommendation and asked me, why do you, in this situation, why do you think this having an episiotomy would be better than a tear? And I wasn't quite sure where this doctor was going. So I was like, well, I was educated this way. And the provider felt that this mom, because of her anatomy, he might have a little more control if he gave her a little bit of a episiotomy and control, as opposed to her body opening up all the way through her rectum.
Yep.
And that in that situation, he presented that, and mom still said, no, I want a natural tear. And the unfortunate piece for this mom in this situation was she did have a pretty significant tear. And he looked at me after, he goes, I really wish we would have trusted our gut in this. And I said, but it's how you present that to the doctor, that presenting that to this mom, the way you presented it to me was very different.
Sure.
And when they are armed with information, you need to explain that this is what your concern was, not just to me, but to that mother.
Wow.
And so I now, though, because of that situation, if I am in a situation where it is recommended, I will then ask a few more questions and make sure that mom and dad are given good informed information.
And even, I didn't really like where they went back in retrospect, and this will happen in a lot of births, in any situation actually, is that, we didn't know. Because even if they did choose to do a small episiotomy, there's no guarantee that she wouldn't have torn more.
Or that, exactly. And so that is why we need to give the decision making back to the families.
Yeah, we have to allow our birthing person to make those decisions.
Absolutely.
Because at the end of the day, if they feel that they were pressured by any decision in their labor, they're going to they're going to start the grieving process.
And that's part of it.
Yeah.
We want to put the choices and decisions back into the parents.
Can I just add on tears really quickly?
Yeah.
I just want to say that stitches are also an option that we didn't put in here.
Yes.
There are natural ways to heal your stitches. And I didn't know this is a new thing. I'm studying herbs, but this just came on my
radar.
Came on my radar. Seaweed is also another natural.
But where would you find that on the market?
So a lot of birthing professionals are going to have their hands on those types of things.
Yeah.
You can find it.
Yep, obviously not the kind that you're going to sit and snack on.
Not the dry, salty
Not the
kind.
salty
You
kind.
actually can. You can use that.
That's
We
all
have
I
used that.
understand.
But that's where it comes from. Whether it's dry salted, seaweed has natural salt in it.
Huh.
Because where does seaweed come from? The sea. And we know, fun fact, I've been to the Dead Sea. And when I went into the Dead Sea, I had cuts all over me. And I was actually very scared to get in there. And I got in there, I stuck my arm in the water, and let me just tell you, by the time I got out and by the time I got back to where I was, it was healed.
Wow.
We know the power.
Sea salt spray for piercings.
Yes.
Tattoo parlors will recommend that for piercings. So just a thought.
It has some things.
The more you know.
The more you know.
But not every tear needs to be repaired either.
Right. Accurate. And I don't remember what layer it is that they recommend.
If it gets down deep in that muscular layer.
Okay. So that's going to be second.
It may be something that they need to do more with.
Yeah.
Any other choices come to mind?
Specifically related to labor, I don't.
The
third stage. That is where we're going with
when
this.
we still have to deliver the placenta.
Yeah.
Yeah.
So one of the things that a lot of people don't know, and at the time, it is in some ways just kind of done, not always even with their knowledge, or the way it's presented is, okay, so now we're going to add Pitocin. Pitocin is a synthetic form of oxytocin. Female bodies, we produce oxytocin. It's one of the hormones that our body produces. In pregnancy, it's a hormone we produce when we have intercourse. It's oxytocin. And so the synthetic form is Pitocin. Pitocin is used a few different ways. It's used to help get a labor going because it causes our uterus to contract. Pitocin is also used after baby is born to help with delivery and management of the third stage, which is the delivery of placenta and or to prevent postpartum hemorrhaging. A lot of people don't realize that in every hospital across the U.S., one of the things they do, especially when you have an IV spaces, they hang a bag of Pitocin, and in different hospitals, policy procedures are different, but the intention is that entire bag being given to mom to help manage a would-be potential hemorrhage. Not a hemorrhage, but to keep you from even getting to that point. Not every woman after giving birth is going to have a hemorrhage. Thus, the question arises, do you absolutely need this medicine? It is, again, a case by case. Some people are like, I don't care, my baby's out, give me the Pitocin. And other people are like, absolutely not, I'd like to do anything I can to avoid that. There are herbs there's homeopathics, there's fundal massage,
Yep.
there are things you can do naturally, and there are options in that. You
Yeah.
can play the wait and see if you'd like. There's also Pitocin that's available by IM injection in your thigh or through an IV. There are a couple ways to do that if needed.
So you're also bringing up the placenta. There's choices around the placenta after it's delivery.
Absolutely,
What
there
What are
are.
the choices with that?
Keep your placenta, throw your placenta away, have somebody encapsulate your placenta, tincture your placenta, do a placenta print, take your placenta home and bury it. Put your placenta in the freezer. Donate your placenta.
You can do a lotus birth.
You can do a lotus birth. Yes.
Wait, what's a lotus birth?
Where you leave baby attached
To the placenta and the umbilical
and
cord.
then deliver the placenta. He or she, whatever you want to do, maybe just the placenta hangs out in a bowl, and you just kind of let it dry, and it'll naturally fall off.
We did that.
You did.
No, but
No, I
this
didn't.
is longer term.
longer.
Lotus,
Oh, this is
what
like until the
eventually,
umbilical
until
cord.
it
Oh,
falls
okay,
off
okay.
naturally,
Yes,
which
yeah.
basically means that in other countries and cultures where they actively do this very regularly, what they tend to do is they have special bags, they have different herbs they put with it because it is rotting flesh and rotting tissue,
Right.
and it does become
Kind of, yeah.
smelly.
Yep.
But some people feel very strongly about this, and there are other families. I had a family last year that typically when we cut the umbilical cord, it's cut by a pair of scissors. What's the word I'm looking for?
Shears?
Yeah, thank you, medical.
Oh, okay.
I thought you were like shears. I don't know.
I had a family that chose to do a cord burning ceremony.
Beautiful.
Oh.
And it was beautiful. They had a special candle, a special box made. They wanted to do it that way. They had read some research that was healthier, better for baby, less introduction of cutting it, introducing bacteria, things like that, infection risk. So that was a cool thing that we got to kind of join in on with that. It was a little special ceremony for this family.
Yeah.
Yeah.
So there are a lot of ways to do it. The most common is the encapsulation
Yeah.
and or tincturing. And truth be told, human beings are one of the only mammals on earth that do not automatically consume their placenta.
Which is an interesting fact.
Because that is more not a Western medicine type
is,
thing.
yeah.
And
We don't
so
view ourselves as animals.
we're
Sometimes
not,
we're
but we
creatures,
are.
right?
We're mammals, right?
Definitely.
And
Definitely.
so it is one of those things that's a personal preference. The benefits,
Yep.
in my opinion, it's nothing FDA tested, nothing that
Right.
anyone can say. My experience have been the benefits far outweigh the risk. And the benefits of placenta encapsulation is more energy in postpartum, helps balance those postpartum hormones, helps with the bonding experience for baby, for moms sometimes, helps balance the postpartum emotions, hormones, because you are basically taking your own hormone back into your body.
Yeah. Right.
And so some people will choose to do that, and it is a pretty, there is a cost investment, but when it comes to postpartum emotions, whether it be postpartum depression, baby blues, postpartum anxieties, it can absolutely be a game changer.
Yeah.
And so it's one of those things that you're not going to find a ton of research and evidence out there, but if you do talk to people about it, they will tell you. I've had some people that say, I noticed a huge difference, it helped me immensely, and others will say maybe or no, it didn't really.
Yeah.
The risk, if it didn't really, then save those, throw them in a freezer, and you can use them later on when your period comes back or when you go through menopause to see if that helps.
Yeah.
Right.
Awesome.
Kind of cool.
That is cool. Like, I love hearing about this candle ceremony too. I'm like, oh,
I have
yeah.
pictures. I can show you
Totally makes more
pictures. It's
sense.
great.
There's so many beautiful rituals
Yes.
surrounding
So many things you can do.
birth and placenta, and just honoring the transformation and the journey that you just went through.
It's pretty cool.
It is.
It's empowering. It's great. It's life changing.
Yes.
Every experience that we go through, we are forever changed,
Oh, yeah.
and we learn. And we are not the same doulas we were last week.
No. And I think that it rolls right back into the education part. And I think that goes into number 6 here, birth support and advocacy.
Absolutely.
What does that mean to you?
Whew.
That's loaded. That's like a whole
It's
conversation,
a loaded-
another
yeah.
hour.
Well,
Right.
I want to ask you this question, turn it around. When you decided you wanted to be a doctor, you wanted to be a chiropractor, you put a lot of thought and planning into that, did you not?
Yes.
And when you got married, did you put a lot of thought and planning into that?
Yes.
When you purchased your new home, did you put a lot of thought and planning
Yeah, I
into
left
that?
that to my husband.
Okay. But the bottom line is,
Right. There's a
for
lot of
these
thought
big
planning.
events
Yeah.
that happen in life,
You want to prepare.
you
for them.
prepare for them.
Yeah.
Why would we not for one of the biggest things that are going to happen to
Yeah.
us, the biggest, most transforming experiences in our life? Why would we not do everything we can to educate, get support, and advocate for ourselves?
Definitely
or
not
for
something I'm
each
gonna
other.
leave up to my husband on that one.
Well,
Sure.
and
You're
not
right.
only
I
that,
don't wanna
but
be a
is
part
that
of it.
even
Yeah.
fair to leave it up to your husband?
Uh-huh.
How often has your husband attended birth?
Right.
Only mine. Like, never.
Yeah. Right?
At least as far as I know, he's never.
I
been.
know,
It's
but
always-
that leads us down to, why would I want to doula?
Yeah.
Right?
Yeah.
And so how can a doula come in and help with that? We are birth professionals. We're professional doulas. We are not hobby doulas. We are not just hanging out at our friends' births because we just love birth. While that is true, we love birth. We are birth junkies. We're passionate. We're a little weird. But it is our profession. We have made it our life's goal to learn everything we possibly can on how to support you, what options are available to you, educating you, all of that, staying up on the latest research.
Yeah.
We really put a lot into that, and it is important for you to have that advocate, because in every other area, as we just talked about, you have that support. Even when you think about choosing life, I have a daughter that's going to graduate next year. She spent a lot of time with her counselor thinking about what she wants to do and how she wants to do it. Same when it comes to birth.
Yeah.
There are a lot of options out there, and it's important for you to be able to explore those options.
Definitely. I want to add too that you made the comment of why put your partner in that position to hold the role or try to hold the role as the birth professional, because I feel like that leaves a little bit of room for potential. I mean, imagine something goes wrong. It's different from the plan or preparations. You know, what are the chances that they may feel that they want to blame their partner for not knowing what to say right away, not being their advocate? And we can't just look at our partner and be like, okay, you're going to come in here, you're going to be my doula, and everything's going to go how we want it to, and we're going to have the perfect time. You know, that's not fair. That's not fair.
Do you ever see where partners go into a birth plan but they didn't fully agree, or situations arise and they're at odds, or like usually
the birthing person and the partner are not agreeing on a situation?
The person that's usually watching this happen has more fear, like, I don't want you to be uncomfortable.
Sure.
You look like you're going through a lot of pain.
Sure.
So what I've typically heard or have experienced is that the person giving birth will delay or want to make their choices feel heard more than someone who's onlooking.
Sure. Yes and no, because number one, if they are working with us, we are incorporating dad into every conversation.
Yeah.
That other person into every conversation, and making sure that their voice is heard also. But we're also making sure they're on the same page for those options and decisions. And one of the ways I educate is, and that can be if you choose to have your husband and your mother, or your husband and your sister and your aunt, the biggest thing I want you to do is make sure that they understand what type of birth you're wanting, what the environment, whether you choose to have an epidural or not have an epidural, whether you want interventions or not, so that everyone knows what your desires are. Because if you are wanting to have an all-natural birth and you are in a birth space that allows for other interventions like an epidural or pain meds, and your belief is, well, I don't like to see people in pain, and I've heard this before, you might be more apt to say, oh, Sandy, you look like you're in a lot of pain. Are you sure you don't want the epidural? It'll take the edge off and you can get a nap. Now, in that weak moment, if you are really struggling and you're like, oh, that doesn't sound so bad, maybe I should get that epidural, that'll help. You go to get that, and then later on you're like, why did I do that? I didn't want that. So it's really important for you and your partner, you and whoever you invite into that space, to be on the same page. And then having that conversation ahead of time, hopefully you won't have that in labor. Is that helping
It
answer?
helps a huge time. But you brought up something else about choosing the people that come into your space.
Yes.
And here's what I'm really curious about now that we are post-pandemic. How has the birthing stage in a hospital changed? I mean, there was like 2020 and 2021 where you're allowed one person, like,
Yeah.
right?
Yeah.
But now we're opening up a little bit more.
Mm-hmm.
What is different still? Or what can we expect?
One thing that's different that actually was a good thing that came out of the pandemic is that doulas are now recognized as part of the team on the medical side, not part of your visitors or like your person in the hospital.
Yeah.
So what has changed in that is that we quote unquote don't count anymore
Right.
as terms of
That's
you're allowed to have
wonderful.
one or two
Yeah.
people.
It is wonderful.
In fact, we come in and they're like, well, you don't count. So, oh yeah, you're allowed to have 2 people or whatever. Each hospital has different policies now. The norm is usually, is it 2 to 4 people, I
Yeah.
believe.
Yep.
And I'll be honest, I've been in birth situations where if we have 12 people sitting there to support you, that can be a little cumbersome too. And I want the birthing mom to know that there could be potential for you feeling like you have to perform or do a thing a certain way or in a timeline. So even though we are able to have more people if we choose, being very mindful of that and making sure. And so that has kind of gotten back to where it was pre-pandemic in most cases. I will say postpartum, they are still trying to limit the amount of visitors you have. I believe here locally at our Corwell Lakeland Hospital, it's about 4 people, but it can be different people. Each day where before it was one person, once you entered the hospital, you didn't leave your room. Now you're able to come and go, and there's a little bit of flexibility in that. And it's case by case. There are different situations out there that they may allow for different types of visitors, but siblings are allowed to come back in for visitation after babies are born, things of that nature. That has gotten back to the norm, and we have never been asked or not allowed since the pandemic. I've been in every hospital in my community down to Nashville, Tennessee to support families in labor during COVID.
Awesome. I thought they were doing it virtually.
Nope.
Awesome.
I never was not allowed to be. I even had a COVID positive patient that I supported in person and virtually.
Yeah.
So there was a lot out there, and there were other states that were a little different because I did have families that had other situations. Yeah. But here locally, it was, in my opinion, a different atmosphere, and we were able to still support in certain ways.
So what would you say you would want expecting parents to get out of our webinar today?
That you got options.
Yes.
Question everything.
Nothing is I can't.
Right.
Or you can't.
Yep. Take the brain method. If you take anything from this webinar, take the brain method.
Yes.
One more time, it's benefits,
risks, alternatives, intuition,
or
and doing nothing, or does this need to happen right now?
Yep.
And apply that to every area of your life, especially when it comes to having to make those types of medical decisions.
Yeah, definitely.
But everything else too. Because if I may, we were given a gut and our instincts for a reason, and you have to trust that. In this situation, as a parent.
Yeah, as a parent.
There are going to be a lot of situations in your life you're going to be faced with. Trust your gut.
Yeah.
Wonderful. Any last remarks?
We love what we do, and if you want more information, please reach out to us because we are always accepting new patients. Even if you are 39 weeks pregnant, it's never too late as long as there is a baby in your uterus. And or if you're on the table and you need help, remember that you saw this and you can reach out to Dr. Sandy and she can get you in touch with us if you need support.
Yeah, we'll definitely put on links and communication on how you can reach Abigail and Kim today. Thank you so much for everything you guys have done and choosing to be here and wanting more. If you do me a big favor, make sure you subscribe, like, and share with everyone you know who is even trying to conceive at this point. So thank you guys so much for your time. Have a good one.
Bye-bye.